Hi, Jethro. Good morning.
Good morning, teacher.
Listen to me well.
I can hear you very well, teacher.
I will put my earphones. Okay, now can you listen to me well?
Yeah, it's better now, teacher.
Perfect. Can you put on your camera?
Teacher, I'm in my computer now and the camera isn't working.
Oh no, Jethro, you have to do something to this because it's so important on the speaking class. Okay, maybe on the other classes it doesn't matter, but here, yes, we need it for the next time. Okay.
Okay, teacher, I'm so sorry.
No worries, but please, you have to see that. Okay. So can we talk about last class? About maybe you can make a list of causes of anemia. Can you?
Teacher, I don't understand the last word. Can you repeat, please?
Of course. Can you make a list of anemia, of kinds of anemia?
Okay.
Maybe you can choose one and try to explain me the causes of that anemia.
Okay. The can I remember now is hemorrhage, hemorrhage.
Hemorrhage. Yeah.
Or I can remember the word, but it's postparto. I don't know how to pronounce that word in English.
Postpart.
Exactly. And the patient is pregnant, and in the postpart, it's we can see anemia too.
Okay. Can you choose another illness and try to explain to me the signs and symptoms? Describe it.
Okay.
Any kind of illness you know better, you can describe it to me, please.
And I can remember the word that is anemia megaloblastica, megaloblastic, and anemia as
Okay.
no sería B12 deficiency. It's it's una causa.
Okay, no worries. You can choose, for example, hypertension or another illness, diabetes, maybe, and try to describe the signs and symptoms if you remember better, okay?
Okay, teacher. I'm trying to remember the illness that I see in the hospital. Um, Maybe hepatic injury too, teacher. Hepatic injury.
Hepatic
Danger
danger?
in,
Yeah,
yeah.
that's good. Okay, go ahead.
Teacher, can you hear me?
Yes, I can listen to you. Go ahead with that hepatic danger. Can you listen to me, Jethro?
I'm not very well, teacher.
Well, I was telling you that you can continue with describing the hepatic danger.
Okay. Okay, I can hear you now, teacher. Well, liver damage can cause anemia because of the process that the glóbulos rojos, red blood cells in this organo, yeah.
If you don't remember the right words, you can describe the action, okay?
Okay, and the process that red blood in the liver.
Okay, can you repeat the last part, please?
I say liver, teacher. We can see in the class, liver and hepatic is the same definition, right? It's the same
Yes,
word.
can use both. Doctors usually use both to describe the same disease. Okay, Jethro. What are the signs and symptoms?
Well, and the principal is nausea
Okay.
and headache. And
Headache.
headache. Yeah, sorry.
Mhm.
And we can see lost weight. Um, I can't remember how to say the word is visión borrosa, blurry. Can't
Yeah,
remember.
that's blurry sight. Can you listen to me? Blurry sight.
Blurry sight.
Yeah.
Okay, teacher. Blurry sight. Lost weight. Headache. Nausea, I can't remember that word. Es como mareos, vértigo, es
Dizziness. Dizziness.
dizziness.
Yeah. With Z. Dizziness.
And more important, I think we can see externamente, in the patient is pallor, palidez.
Yeah, pallor.
I think this is more
Okay, those are the most common ones.
exactly. I think the last one is the most notorious in the patient, the pallor.
Okay, pallor. Perfect. Okay, thank you, Jethro. Remember we were talking about fractures?
Yes, teacher.
Okay, if you have to diagnose a stress fracture of the tibia in a young female dancer, how would you explain to her the cause of this fracture and the management of this condition? Imagine you have a patient, and this patient is a female dancer, okay? She
Okay.
has a fracture. how would you explain to her the cause of the fracture and the management of this condition?
Okay, I'm trying to explain the patient, but I'm, I don't understand the cause, but maybe I can say it maybe do a very strong blow or a low calcium levels with the patients. Um, ¿Cómo se dice esta palabra?
If you don't remember, you can describe it.
Okay, maybe say, that's right. The low calcium levels that the patient may have is the most common.
Okay, that's good. But I ask you to explain to your patient what does she have and how would be the management of this condition or the treatment.
Okay, I can say you have a fracture because the cause is where I can see the level low calcium, or maybe that's the most common I can say. And the manage is no recuerdo bien cómo decir el cómo se dice no es yeso el I put it in the class is el el yeso que se pone debajo del asiento, no recuerdo ahorita.
Sorry, Jetro, can you repeat it, please? I couldn't listen to you.
Se tiene que la palabra que estoy buscando es el vendarle, o sea, ponerle el yeso al paciente, se me va ahorita, igual no recuerdo.
Okay, I was mute. The plaster cast? Are you talking about the plaster cast or bands?
Exactly, bands, teacher.
But bands, I don't know if you can use it in a fracture or maybe, yes, I don't know. You are the doctor. This is a kind of fracture that just may need bands, or maybe it's the one that needs a plaster cast. Remember the plaster cast?
No, I can't remember that word, teacher. Es
Okay,
el yeso que
plus
se les
it's
se les-
like a ferrule. Okay.
Exactly. That's a
Okay.
word.
Okay.
Okay.
Also, we have, remember, a pin. Okay, that is something harder and resistant. And we have a plate and screws that maybe it will use you will use it on surgery. Okay, but the
Yes,
plaster cast is el yeso. Remember that.
yeah, teacher, es another word. Aquí me anoté es splint. Is the same? Splint?
Splint are those three ones that I already mentioned. It's something that you can use to recover the movement of the limbs. Okay?
Okay, teacher.
Okay, so go ahead. Can you add something else or that's enough?
Maybe that's the more important. Maybe I can see you have a fracture in your leg or in your arm, and
Okay.
maybe I can show her the radiografía.
Right. RX or radiography.
Exactly, a radiography.
X-ray, I'm sorry, X-ray or radiography.
X-ray or radiography, I can show her, and I
Mhm.
can explain you have fracture where you can see, and the principle. And what I can do now is very important. It's has to immobile
And mobilize.
and mobilize and and immobilize your legs or your arm and put on a splint or it's splinter, right, teacher?
Yes.
Okay,
Whatever you choose for this case is a splint. Okay.
okay, maybe you can use this for maybe or depends of the part of the body. You can use it 3 or 4 months. Now it's very important. But I can see very
Okay. Okay, Jethro, that was good. The objective of these classes are that you can practice a lot. Okay, you can get another vocabulary, and you can use a lot of words that you don't know, and you can also practice with me your English. So try to listen, maybe, or read some books or podcasts, okay? And practice more. Jethro, can you see my questionnaire? Okay, and fill it for me, please. Thank you. And Jethro, are you here? Oh, yes, are you here?
yeah, yes, teacher.
Yeah. Okay, I will take a picture. Of course, I can see you today, but remember that you need the camera on for the next classes, okay?
Okay, teacher. Thank you. I'm sorry.
Okay, no worries, but please, for the next classes. Okay, Jethro, thank you so much. See you on Monday.
Okay, teacher.
Take care.
Have a good day.
Bye-bye. You too. Hi, Carla. Good morning.
Good morning, Miss.
How are you? Thank you so much for coming so early.
Don't worry.
Okay, can you listen well now to me?
Yeah, it's okay.
Okay, perfect. Carla, can you make a list list the causes of an anemia or another illness that you can have on your mind?
Anemia.
And I can I ask you to put on your camera, please?
Okay. Just wait a minute, please.
Yes, of course. And you can go ahead with your list. You can name a list of causes of anemia, as I told you, or another illness that it comes to your mind.
Okay. First, we can we have maybe hemolytic anemia. Could be another. Could be by deficiency. Is it correct?
Deficiency.
Deficiency. Vitamin B12. Another will be megaloblastic anemia. Well, okay. I am. Yeah. Okay, will be those. Another causes of an anemia will be when the, how can I say, la médula ósea?
You can say, let me check this.
Okay.
I don't remember either. Okay, continue. If you don't remember this illness in particular, you can choose one that you usually see on your consultation or in your practices, okay?
Okay, talking about anemia, the causes are the hemolytic anemia is for medulla ósea is not making enough red red cells. It's okay.
Erythrocytes.
Erythrocytes.
Or red cells, right?
Red cells. That
I'm sorry to cut it now. Bone marrow.
bone marrow is that medulla ósea.
Medulla ósea, yeah.
Bone. Okay, thank you. When the bone marrow is not making enough erythrocytes to replace the that those are destroying, it's correct?
Those are the?
Que están destruyendo, destroying?
They are being destroyed.
They are being destroyed. Okay, thank you. And that I think that the patient could have maybe headache, feel, I don't remember the word, I think is mareado.
First of all, headache, okay?
Headache.
And the other word you're looking for is dizziness.
Dizziness, okay, thank you, Miss. Dizziness, also vision, I don't know.
Blurry sight.
Blurry?
Blurry sight.
Blurry vision.
Blurry sight, yeah.
Blurry
sight.
Okay, thank you. Thank you, Miss. Also, well, this is an autoimmune.
Autoimmune?
Yes, illness.
Yeah.
Yes, I think that.
Okay.
And also feel weak with anemia, right? I think that maybe another illness. Well, I usually in this time it's common to see resfriados. I don't know how can I. Excuse me?
Cold?
Cold.
Cold.
Yes,
yeah.
Cold. It's very common. Most of the children's go to the doctor to see this problem with their parents.
Okay. You can say it blurry vision, as you said. Okay, if you want to describe.
Okay, blurry vision, right?
Blurry vision.
Okay, sorry. As you know, my speaking is not very well.
But we are here to practice, so no worries, okay?
Okay, thank you. Yes, the cold. Is that correct? Yes.
Yeah. Or flu. I don't know which of these ones you want to use. Yeah, cold or flu.
Flu. Yes, the children's most common symptoms.
Symptoms.
Yeah. They have I don't know the word in medicine, but rhinorrhea in English, rhinorrhea.
Okay, I will find out.
Another will be, I don't know how can I say in English, odinophagia, medic term, odinophagia,
It's the same.
dolor de garganta.
It's the same. You have to use odinophagia is the word.
Odinophagia. Okay, thank you. Another headache, they can have
Or
headache.
sorry, odinophagia. Odinophagia.
Odinophagia.
Yeah.
In writing is the same or just
Yes,
a
just that you have a PHA. I will write it to you on the chat, okay?
Okay, thank you, Miss.
But you can continue.
Odinophagia, rhinorrhea, but I don't know the term of that. Headache.
I think it's runny nose. But we can find out another way to say it, okay? Maybe for the next class, you can find out another word to say rhinorrhea.
Okay, Miss,
Okay?
I'm going to write in that, so. Okay. After that, we can have most of them also when it's infection of bacteriana. How can I say that?
A bacterial infection.
Bacterial infection. They also have I don't know how to say tos con expectoración.
You can say the patient has cough with expectoration.
Okay, cough with expectoration. Yes, and they also have placas in the amygdalas, and amygdalas are hypertrophics, will be.
Yeah, hypertrophic.
Hypertrophics, and they also have well, here called placas in amygdalas. I don't know.
Okay, we can use the word plaques.
Plaques. Okay, we can see that. Sometimes we can hear with the stethoscope and
or plates. You can say plates.
Plates, like for placas, right?
Yeah, plates. I will write it to you.
Okay, thank you, Miss. Plates.
No worries.
Plates. Blurry vision. Okay, thank you. We can hear with stethoscopio.
Stethoscopy.
Stethoscopy, lungs, and we can hear maybe, I don't know how to say, estertores.
¿Extractores?
Sí, estertores will be crepitantes, will be, well, I don't know the words in English.
Okay. ¿Extractores or expectores?
Estertores.
Estertores.
In English.
Okay.
I don't know what can I say.
Okay, I never heard that word before, but we're gonna find out.
Okay,
no worries.
Estertores will be, but those are more in illness like bronchitis will be another illness.
Okay, that's a stethoscope, and that's the way you should write it. Okay,
thank you, Miss. Stethoscope.
Now, the word was estertores.
Yes.
Rails.
Rails?
Rails. Like, can you describe this word to me?
Okay, they are ruidos. How can I say ruidos?
Or sounds?
Sound different in lungs.
Okay. When the doctor asks you to inhale an
Yes.
exhale, and they just put the stethoscope on the chest and he can listen, right?
Well, yeah, they
Territories.
indicate a pathology, an illness. Will be a pneumonia.
Pneumonia.
Will be another. Will be asthma. Will be another illness. It depends the source of the lungs when they breathe, right? Respire.
Breathe.
Yeah. Breathe. Sorry.
Yeah, when they breathe.
It depends. We can auscultar. How can I say auscultar in English?
The doctor makes an auscultation.
Auscultation. Okay, thank you, Miss. I think that in this case, and yes, and well, if we have a bacterial infection, we can indicate antibiotics.
Antibiotics.
Antibiotics, and if it's not a bacterial infection, we can just indicate symptomatic tabletas.
Okay, pills.
Pills, yes, just symptomatic pills to reduce the symptoms.
Symptoms.
Okay, sí, symptoms.
Okay, Carla, it was so good. We had a good conversation here.
Yes,
of course, you're here to learn more vocabulary and everything, and it's okay if you ask. And if I don't know the word or I don't remember, we will find out. Okay.
Thank you, Miss.
I don't know if you can see my questionnaire.
Yes.
And
Yes,
can
yes.
you fill it, please?
Thank you.
And again, thank you for coming so early today. We have another class sorry, we have another class. Yes, but not on Monday. We have to make another class of this because we missed the first one, practical class, remember?
Yes, Miss.
I was traveling and I suspended, right? And we have to make it another way. I will ask you, of course, to have another time like this, okay?
Miss,
And
I have a question. Sorry.
yeah.
When is Monday? We have to talk about an illness in groups, right?
Yes, yes.
The illness that you have to tell what is the illness, or we are going to choose.
No worries. I will give you the illness, like today, for example, and
Okay.
you will discuss and you will tell me on your groups what kind of thing. Yeah, okay, that will be something fun, I think, and of course we will find out more vocabulary there. Okay.
Okay. Thank you, Miss.
Thank you so much. See you Monday then.
See you Monday.
Bye bye. Hi, Rina. Good morning.
Hi, teacher. Good morning.
Thank you for coming so early. First of all, I don't know if you can listen well to me now.
Yes, right now.
Okay, thank you so much. Thank you for coming so early, okay?
Okay.
I will ask you to make a list of causes of anemia or another illness you wanna choose.
Okay. About anemia. There are different causes. For example, in the kids and the causes depend the age of the patient. In the kid, for example, the causes is the low in the kids is for the deficiency for food without iron. For example, another causes is for the type of the alimentation because the diet it's so poor or is bad according with the age. Another causes is because for the deficient of the vitamins, for example, deficient of the vitamin B12 or cyanocobalamin. And in the adult, the causes is similar, but in the adult, it's there is the for the traumas, for example, when the people has loss of the blood or bleeding, there is another causes. The another causes is in the seniors is for the age because it's deficiency of the. It's not only for the iron or the diet. It's is because the another causes is I don't know how to tell you, but it's the age of the people when past the 60 years. The deficient of the for the causes of the anemia. Is the age? Is the I don't know.
Older age?
Yeah.
It's related to older age.
Older age, yeah.
Okay.
The causes is for the what I tell you it accumulate of the causes belong the life of the person causes anemia too. I think like that is that yeah, I remember
Okay.
right now the causes.
Okay, no, that was good. I asked you to make a list of causes and you give me a lot of causes, okay? Just one thing, when you have a lot of vocabulary and you can make yourself understand. The only thing I will ask you to practice maybe your pronunciation, okay? And
Okay.
that will be getting better with the practices of these classes.
Okay.
Deficiency, okay? Not deficient. Deficiency of iron, for example, but deficiency, okay? And but you were good. We're good, Rina. Okay, and remember, I don't know if you wanna describe the signs and symptoms of some illness you remember or that comes to your mind.
About the anemia or another illness?
No, another illness you wanna describe.
I think I want to talk about illness. More an illness, probably. Illness.
Yeah.
Illness. It's about I think jaundice. It's not exactly an illness. It's a symptom. I think jaundice.
It's a condition.
And a condition. Yeah.
Okay. Can you repeat it, please? I couldn't listen to you.
Jaundice.
Jaundice.
I think. Yeah.
Okay. What should be the word in Spanish?
Ictericia.
Okay. Yeah. Please describe it.
Okay. Jaundice. In fact, it's a condition about. It's a condition when the liver has a problem with the metabolism of the bilirubin. In the liver, well, the process or the metabolism of the bilirubin in the liver is usually that convert the bilirubin and transform the bilirubin conjugada and no conjugada. I don't know how it's exactly word in English, but when there isn't a problem, an obstructive problem, for example, or another condition when the liver produce more bilirubin, and the liver cannot convert the bilirubin, so there is starting to accumulate in the body, and that is the reason why the people has in appearance in the skin. Well, and the people, you can see the skin in a color with a color yellow. Yellow in the skin, in the muco and the mucosas, and the eyes, and the sclerotic, and when there is a condition very seriously, when especially with the newborn, because if you or the doctor no treatment or not attend the condition in the newborn, that the jaundice transforms kernicterus. That is another name, because the bilirubin in the nervous nervous system is very bad and have a consequence that cannot convert. And the people, when there is another age in the kid or an adult, is how it's necessary to attend to, because transforming another condition, but one of them is a problem with the process, the bilirubin, and if you have a condition in the liver, that is in a problem too, because it's an important organ in the system, because produce enzyme, transform bilirubin, transform or produce another factor the coagulation, and the jaundice is a condition that is have a looking, it's necessary looking for a cause. Yeah, and another fact, very interesting, jaundice is a word in French, and I didn't know that. I learned that word in French, in fact, and after that, some friends told me that is the name of ictericia in English. So that's very interesting.
Okay, thank you. Yeah, that's interesting. And it's the correct pronunciation is jaundice. Okay?
Jaundice.
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 I don't know in French how does it the pronunciation. Maybe like you were pronouncing, but in English is jaundice. Okay.
Okay.
Talking about mucosas, you can say mucous membranes.
Okay.
I put it on the chat side. Okay.
Okay.
So we can remember that. And what else? That was good. Your description was good. You have a lot of vocabulary, a lot of technical vocabulary, and that's really important. The only thing we have to practice, as I told you, is just pronunciation. Okay?
Okay. Yes.
But you make yourself understand so well, and I'm happy for that. Okay, let's talk about another topic. Remember, we were talking about fractures, right?
Yes.
Remember that you have a patient, okay, a young female dancer, for example. Well, how would you explain to her the cause of her condition, and how would be the management?
The causes, all the causes of the fractures.
Oh, no. Imagine you have a specific patient. She fall down, I don't know, hit by a car. It's about you. It's up to you. And you have to give her the information, because she doesn't know what does she have. and then you can make a treatment for her and tell her. How would you explain to her?
Okay. I have to her, for example, okay, you shows an for example, it is in a fractures, I don't know, exposure, oh my, no, in a fracture
Displays or
displays.
committed, you pick one. You're the doctor.
Okay.
I really don't know exactly what kind of fractures it's common in these cases, okay?
Okay. For example, in a fracture displaced, I have to tell her, well, you have an, I can see the radiography, for example, and I note that is you had a fracture displace, a consequence of a trauma, and the treatment it have to put in a ferula that I don't remember the name.
Burial.
Ferrule. You have to you have to put you have to use in a ferrule for 3 months because that is the process, and you have prohibited to move the leg for because it's mainly it's important don't move for the bones
To
recover
heal. Okay,
to heal.
perfect.
Okay.
Perfect. Maybe you wanted to say plaster cast. Yeso?
Yes.
Yeah.
So
Okay, plaster cast.
plaster cast.
Yeah.
Okay.
Remember, you can see the slides of the last class if you want, and we have those things, right? I don't know if you can see my questionnaire. I'm sorry, but we have a few minutes, just 2, I think. And
Yeah, I do it.
can you
finished.
feel it? Thank you so much. I will take a picture and I will let you rest and have a great weekend, okay? Thank you so much, Rina. See you on Monday.
See you, teacher.
Take care.
Thank you.
Bye-bye. Thank you. Okay, hi Ale. Good morning.
Good morning, teacher.
Ale, can I ask you to put on your camera?
Yes, give me
Please.
1 second.
Okay. Okay, first of all, thank you so much for coming so early and give me the chance to change the schedule, okay? Just for today and maybe another class more, but we have to replace another one because of the first practical class. Remember?
About the first practical class?
Yes, we didn't have that first practical class and we have to replace it too. Okay, just to let you know, I will ask you, of course, if you have time to recover this class on a weekend or maybe during the week after theoretical class, maybe, or something like that. Okay, we will figure it out.
Okay, teacher.
Okay, Ale, can you make a list of causes of anemia or another illness that comes to your mind?
Okay. Maybe for malabsorption of I don't know how you can say folatos or vitamin 12 and hypovolemic Deficit of
Hypovolemic.
hypovolemic. Okay. I don't know how you say deficit.
Deficiency.
Deficiency of yes.
Iron.
Iron. Okay. Deficient of iron. Deficient of complejo. I don't know so much technical medical words.
No worries, we're here to learn, okay, and practice. A B complex.
Okay, the B complex. Chronic disease.
Okay. Just to let you know, eufolatos, we can say eupholates.
Eufolate. Okay.
Yeah.
Maybe cancer, like leukemias.
Okay, those are the most common causes of an anemia, right?
Yeah.
Perfect. And can I ask you to pick any illness you want, and you can describe the signs and symptoms?
Okay. Maybe, I don't know, the appendicitis. We can see in the symptoms, maybe the patient have anorexia, don't want to eat anything because that causes pain. Pallor of the skin. Give me 1 second, teacher, please. I have a flu and I want to.
No worries, go ahead.
Okay. Okay. Maybe nauseous. And signs, the vomit. Maybe the person have a constipation or diarrhea. And the classical is the pain. The pain have a characteristic. In the first 3-4 hours, the pain don't have a specific localization. But past 4 hours, the pain have a specific localization in, I don't know, the fosa ilíaca derecha.
Okay, I will find out. I don't remember either. But location, a specific location. Okay?
Okay.
And something else you said. I don't remember. I will find out and I will tell you. Okay, go ahead.
Okay. Maybe for the exploration, physical exploration, we can see specific points of pain at the abdomen. I don't know how can explain all that points are a lot of points.
If you don't remember a word, you can describe it.
Are medical signs like McBurney point?
Okay. It's a name
Yeah, it's a
of a
name
condition.
for
Okay.
not a condition of a point of localization, a specific
Location.
location.
Mhm.
Sorry, location for a specific point of the abdomen.
Okay. And just to let you know, I put on the chat right iliac fossa. Okay. Or left iliac fossa.
Okay. Other sign is the fever. Yeah, it's very important. Signs. Maybe that's the most important symptoms and signs.
Perfect. Perfect. Thank you so much. Maybe, I don't know, but I'm curious about that. Can you maybe get some confused with the pain on the right side, for example, with an ovary pain?
Yes, yes. We have other diagnostic with is the
A differential diagnostic.
a differential diagnostic when it's in a left iliac fossa. But we have a specific sign when you touch, when you have palpate.
Yeah.
In this place.
Palpation.
Oh, okay. When you do the palpation at the left iliac fossa, the pain localization is in the right iliac fossa when it's appendicitis, and that is the right sign, rupturing sign.
Okay, so if I have pain on the left side fossa, right, it can be appendicitis.
When you palpate, when you do the palpation at the left iliac fossa, the pain is in right iliac fossa. That's
okay, so it refers the pain.
Yes, yes.
Okay, that's interesting. Okay, Ale, thank you so much. That was good. I will ask you to remember about the fracture. Okay, imagine you have a female young dancer patient, and you have to explain to her the cause of her problem and the management of this condition.
For cancer?
Or a fracture. She's a female dancer, so she had a fracture. Yeah.
Okay. Maybe the kind of the fracture, maybe it's a transversal complete fracture, or oblique or spiral or conminus, and that need immobilization for long time. Maybe with a treatment, medical treatment, or chirurgical treatment.
You can say or surgery.
Or surgery, but she will need immobilization for a long time, maybe around 3 or 4 months. And for that kind of people is hard, but it's not a complete fracture. Maybe the time is less. But maybe the woman have complications, and we need to see that.
Okay, Ale, that was good. You actually have a lot of a good pronunciation, okay? We only need to practice more vocabulary maybe. And I think we will getting better with the time in this class, okay? I don't know if you can see my questionnaire.
Yes.
Can
Yes,
you
yes.
fill it for me, please?
Yes.
While I'm taking a picture. And thank you so much again for coming early.
problem.
Remember, we have class on Monday at 8. Okay?
Okay.
Okay, Ale, thank you so much.
Bye,
So
teacher.
see you on Monday. Bye-bye.
See you Monday.
care.
Have a good day. Have a good week.
You too. Bye.
Bye.
Get better. Hi, Andres. Good morning.
Good morning, teacher.
Andres, can I ask you to put on your camera, please?
Yes.
Thank you so much. So first of all, thank you again for coming early and have the patience to replace this class today, okay? Okay, I will ask you to make a list of causes of anemia or another illness that comes to your mind.
List of concept of anemia.
Yeah.
Anemia is a disease of red cells. Is characterized for low content of blood, immune and the inmunocells, células inmunológicas.
Immune cells.
Yeah. Is a disease so dangerous for patients, and it's is treated o es tratado. Is treated like a emergency.
Like a
Emergency, como emergencia.
emergency.
Emergency.
Okay. Okay, Andres, that was good. And I don't know if you can describe to me another illness, pick one, and you describe the signs and symptoms of this illness.
Yes. For example, in Friday, the last week, I I have a presentation of aneurysm, cerebral aneurysm. Is a disease that has symptoms like dolor de cabeza,
Cephalia or headache.
Cephalia, disorientation, Symptoms and neurological symptoms like loss of memory and pérdida de tacto.
Okay, pérdida de tacto or loss of sensitivity,
Loss of
right?
sensitivity. Loss of sensitivity, and it's a disease that is like a it's dangerous because if aneurysm explode, it cause hemorrhage
Hemorrhage.
in intracranial ball.
Okay, yes, that's a very important illness that we have to know about. And okay, your description was so good. Of course, we have to practice more pronunciation and we will get a little more vocabulary on this during these classes, okay? So no worries. If you don't have in your mind the word you're looking for, you can describe it always, okay? Remember, we are here to practice, so no worries if you have any doubts and ask me something. And if I don't know, we're gonna find out together, okay? Perfect. Remember that we're talking about fractures too?
Fractures. Yes, I remember.
Okay. Well, imagine that a young female dancer comes to your consultation, okay? And you will treat her. But I don't know, how would you explain to her the cause of the condition of this woman and how would be the management?
Well, for explain her, I explained that fractures are normal in dancers for the moment or the move that her do. And I explained that she must care her health. Maybe I say her I say she that consumir o tomar
To take
to take vitamins or more calcium, more
vitamins or calcium.
vitamins or calcium. If she has a fracture, I say that we try to repair her fracture. Maybe she need to repose for a few days. Yeah, care, take care or tener mucho cuidado.
That was good. Take care of her condition, right? And what kind of fracture is the most common in dancers or by accident? I don't know.
I don't remember the name, but it's horizontal, horizontal, de lado a lado.
Displaced?
Yes.
Yes, or we have committed, remember? On a stick, displaced. So what kind of fracture do you think? Because I think the treatment will vary with the type or fracture, right?
Yes, I believe that displaced because for falls or something that
Yes, I think displaced it would be the most common one. And what would it be the treatment of this?
The treatment, I think that the treatment is mm, try to no me acuerdo. Try to pound tornillo o placa, and after that enyesar.
Okay, remember we have a plaster cast that is yeso, right? A pin that is something more harder and strong, and a plate and screw. Those plate and screws, you have to make it on surgery, right? Remember that? Just
Yeah.
to let you know, you can watch the video of last class to remember this kind of things, okay? But it's important that you can have your vocabulary more expanded, okay? And try to watch the videos if you don't remember, because I know in an hour it's a little bit too much time to stay focused in something, and you just go away in your imagination to another thing while I'm talking, I'm speaking, and that happens every time and to everyone. But we have the chance to watch again the video, and we can remember so many things, okay?
Yes, teacher.
Okay, Andres. And that was good. We have to practice our vocabulary and our pronunciation. I know that during these classes, you will get better with this, okay? I will also give you a podcast, and I don't know if you have TikTok.
Yes, I have.
Okay, I will find out maybe some page or profile on TikTok that can help you with your vocabulary and pronunciation. And you can follow them, and it will help you. Otherwise, anyways, you are on TikTok most of the time. I can say, I don't know, but it's the most common thing now, right?
Yes.
Yes. Okay. Okay, and the last thing that I will ask you, because we have 5 more minutes that we have to practice. Pick another illness, any kind of illness you want, and make a description and a treatment.
Mm,
I don't know, the
um,
most common ones: diabetes, hypertension. Nah, I don't know.
uh, hypertension, hypertension,
Hypertension.
hypertension. Uh, it's hypertension is
Condition.
a condition that aumentar is often. It's a
Where
condition.
what do you want to say? Describe the thing if you don't remember the word or the idea. I can help you.
I have I have the idea, but in Spanish, not in English. But I know that it's a condition that grow the pressure or the blood pressure in patients, and that
Pressure,
pressure,
blood pressure.
blood pressure in patients,
Patients.
in patients, and it's It's provocar.
It provokes,
It provoke that
or it causes.
it's caused. It caused that organs has damage, or has a
Okay.
problems in future.
Okay, so it's a hypertension is a condition that elevates the blood pressure, and it causes that organs were damaged or get damaged, right? Okay. Remember, at first we have the words, the idea, but we cannot put it on order. We have to try to make ourselves understand. So try to think about the words you can say and or the idea, not only the word. You're translating on your mind the word. First word, this, and try to say it. The next word, this. No, it won't help you. Okay? You have to translate the idea. What's more, you have to think in English. I know we are Spanish speakers, but we have to think in English, okay? That's why we are studying this. And it will help you a lot to think in English. It's not easy, but it's not so complicated, okay? So in your mind, try to say another thing that you want to say, but make yourself understand. Okay, go ahead. What would it be the treatment for this?
Well, treatments, it's the treatment is pharmacology. It's a condition, it's a chronic condition. In Bolivia, use a medication called losartan or enalapril, that it's hypertension medicals.
Okay, hypertension drugs. Okay, thank you for filling my questionnaire, Andres. And see you on Monday, okay?
Thank you, teacher.
Thank you, take care. Have a great week.
Goodbye.
Bye-bye. Okay, good morning. Can you listen to me? Hello?
Hello, teacher. Good morning.
Weimar.
Es que me conecté con, con números.
Okay, Weimar. But we have 8:30 for you. Now it's time for Jorge Brun. 8:15 for Jorge Brun, and Weimar, you have 8:30. Can you come back at 8:30?
Teacher,
¿Puedes
Jorge?
Sí, a las 8:15 era Jorge. No sé por qué no ha entrado. Imagino que ya va a entrar. 8:30 eres tú.
Ah, ya, es que lo vi en el 8:15, creo que decía. Ya, está bien, teacher.
A ver, revisemos, pero de todas formas, no te salgas, espérame. Cuidado, haya puesto mal y los haya cambiado tal vez.
Sí, creo que los cambié.
Si es así, continuamos. Jorge Brun, ay, es verdad, es cierto, los he cambiado. Okay, baby, let's continue then. How are you today?
I am good, teacher.
Okay. And thank you for coming early, okay?
Okay.
Okay, I will ask you to name the causes of anemia. What are the symptoms or the signs of anemia? Do you understand the question?
Yes, teacher. Thyroidness, Pelenis,
Again, can you repeat it, please?
asthenia,
Asthenia, okay.
asthenia, thyroidness también.
What is the word? Can you describe the word?
Teacher, no lo escuché muy bien, teacher.
Can you describe the word?
¿Le escribo, teacher?
Describe. Describe la palabra que quieres, que estabas diciendo.
Cansancio.
Tiredness. Okay?
Sí, yes, teacher, tired.
Yeah. Go ahead. Continue.
Em, sería Paylor, Paylor, pálidos,
Pallor. Pallor.
pálido,
Yeah.
pálido.
Okay. What else?
Que todo eso, teacher. Yeah.
Okay, Weimar. That's good. Can you put on your camera, please? Okay, perfect. Now we can see each other. Okay. I don't know if you wanna choose another illness, any illness you want, and describe the signs and symptoms. Can you understand?
Chest pain, podría ser.
Yes, of course. That is a condition. Okay. Describe the signs and symptoms. Can you remember the signs and symptoms of, just to know, of hypertension? Or diabetes?
Hipertensión, teacher.
Yeah, yeah.
O bueno, hace rato le dije de dolor de pecho, podría ser también. O hipertensión.
Está bien. Lo que pasa es que el dolor de pecho no es una enfermedad como tal, es una condición. Y es hasta un signo y síntoma, ¿verdad?
Yes.
Te duele el pecho, esto es un signo. Entonces, te va a ser un poquito más difícil describir eso. Pero en cambio, si describes la hipertensión, que tiene varios signos y síntomas, o diabetes, vas a tener más facilidad. ¿Ok? O apendicitis, no sé, algo que te venga a la mente. Tú escoge con qué te sientes más cómodo, pero describí. Trata de describir. Lo vamos a trabajar aquí ahorita. Tenemos unos minutitos más.
Ok, podría ser Diabetes, teacher.
Perfect. Go ahead.
Bueno, de diabetes present poliuria,
Okay.
poliuria,
Polyuria.
fatigue, fatigue, steni, polidipsia,
Yeah,
polidipsia,
polydipsia.
astenia, astenia,
Okay.
adinamia, pérdida de peso, teacher.
What is the first loss of weight?
Lost weight,
Yeah.
lost weight.
The word before lost weight. What was it?
Pérdida de peso.
Before that. You say asthenia?
Teacher,
You said asthenia? Asthenia? Can you repeat the symptoms and the signs, please?
poliuria,
Yeah.
polidipsia,
Yeah.
astenia, cuando están entrando a cetosis diabética, podrían presentar.
Okay. Try to explain it in English.
Oh,
please.
okay, teacher.
The other word?
Bueno, patient, present, poliuria, polidipsia, astenia, pérdida de peso, lost weight,
What is
adinamia.
asthenia? Can you describe the word asthenia?
Okay, teacher. The asthenia is weakness, debilidad.
Okay. Or fatigue, right?
Yes, of fatigue.
Okay. Continue, please.
Also, vision loss,
Lost vision.
loss vision, pérdida de visión, loss vision. Also, ya me salió la encuesta.
Yes, it's okay. You will feel it after this conversation. Okay.
Okay,
And the correct pronunciation is asthenia.
asthenia.
Okay. Asthenia. Because it has a TH between the E and S. Okay. Asthenia. Okay, go ahead, please. What else? Weimar, un favorcito. Llénamelo mi cuestionario, te lo pido.
Yes, teacher. Teacher.
Ok. Lo que quiero es que tú repases pasamos una clase teórica. Vas a volver a ver el video y escuchas la pronunciación y repites. Eso te va a ayudar bastante, ¿ya?
Ok,
Cosa de
teacher.
que cuando vengas a mi clase teórica, tengamos tiempo de practicar y puedas describir de manera correcta y hablar un poquito más fluido. No va a ser rápido, pero sí lo vas a lograr. Solo que necesito que practiques,
Ok,
porque
teacher.
ahorita tenemos solo 15 minutos, lamentablemente. Ojalá hubiera sido más. Aún tenemos una clase por reponer, por si acaso. Les voy a decir cuándo va a ser y si tienen tiempo también. Pero hasta entonces necesito que practiques porque no podemos perder mucho tiempo que no tenemos. ¿Ya?
Ok, teacher.
Okay. What else? We have 2 minutes left. Continue describing.
Ah, ok. Ok. Bueno, a la parte de fractures podría ser, teacher.
Yes,
Vamos
yes,
igual.
please. It will be good. Yeah. Go ahead.
Mm, teacher, ahí tenía una,
Ujú.
una pregunta, por ejemplo, para decir tienes una fractura de pierna derecha, podría decir you have a rib left fracture, así de manera a explicar a los familiares.
Yes, a rib fracture. You have a fracture on your rib, on the side, on the left side. You have a fracture on the rib, but you're saying that you have a fracture on the upper side. ¿Qué quiere decir? Tienes una fractura en la costilla derecha, ¿verdad?
Yes.
You
O en la
have
pierna derecha podría
en
ser
la
también.
pierna. You have a fracture on your left leg or right leg. Okay?
Ok.
Okay. Thank you so much, Weimar. We will see you on Monday, okay?
Ok, teacher. Thank you.
Thank you. Take care. Bye-bye. Hi, Jorge. Good morning.
Hello, good morning. How are you?
I'm fine. Thank you so much, first of all, for coming so early.
Oh, no
Okay.
problem. It's okay. Thank you.
Thank you. And remember, we have to replace another class, the first class that we couldn't make it, okay?
Okay,
But
sure. No problem.
I will tell you, I think next week, maybe if
Okay.
you don't have time for the next weekend, we will make it after a theoretical class.
I'm okay. I'm available on weekends. No problem.
Perfect. Okay. Thank you. I will ask you to make a list of causes of anemia.
Okay, a list of
Please.
causes of anemia. Okay. First, I would say malnutrition. After, I would say genetic factors, maybe autosomal dominant or recessive diseases. Also, cancer can cause anemia, aplastic anemia. Also, some treatments, some antibiotics may cause anemia. What else? Malnutrition.
Sorry,
Cancer.
that's interesting. What kind of treatments will cause anemia?
Antibiotics, for example. I think chloramphenicol is one of the big issues that may cause anemia because it causes aplastic anemia.
Okay, thank you.
Yeah, there are some others that are like they compete for cytochrome P450, and they also cause anemia. Some, for example, I don't remember actually very well, but some drugs that are for treatment to treat, I mean, epilepsy and that stuff. For carbamazepine, for example, I think.
Okay, I didn't know that, and that's interesting because, for example, on my career,
Mhm.
I have to make some sessions, some short sessions with these kind of patients with epilepsy, right?
Oh, okay.
And maybe if I will make a surgery or something like that, I have to know if they are taking this kind of drugs, and if it's true that it causes that kind of things, well, the treatment will fail, right? In my case.
Yeah.
So that's interesting. Thank you so much.
Oh, you're welcome. I just learned this because I didn't even know that. I just learned this. I'm studying for the English test for step 1, and I just learned this. So yeah, there's a lot of things that they didn't teach us in med school. So
Yeah.
yeah.
Okay, Jorge, that was good. And I want you to pick another illness or disease that you can describe, maybe the signs and symptoms. And if you want, we have time, you can describe the treatment.
Okay. Maybe I could talk about. I'm really into neurology and that stuff. I would like to talk about maybe. Oh, I don't know. Trigeminal neuralgia, maybe. Okay,
Okay.
because something I like.
One interesting topic.
Yeah.
Okay, go ahead.
Okay, in this case, this is a kind of very painful disease. There is some people that also in the story that have had it. They committed suicide because it's very difficult to treat. It's not that easy. In these cases, patients refer a lot of pain on the facial area. This is a kind of pain that increases when people is chewing due to the trigeminal nerve function. It increases. It is like a throbbing pain. You know, that pulses. It pulses. So it's like they describe it as it is as like electricity. So basically, it is very painful pain. What else? The treatment is based on carbamazepine. It works. Also, pregabalin. Those are good drugs to treat this disease. But in some cases, like the pain does not go well with this treatment, and they have to do a surgery. They have to cut the gastric ganglios. They have to cut it sometimes, so it is the only way to relieve the pain. The causes are like mainly vascular. That's what it is, throbbing pain, because it pulses. When the artery pulses, the pain goes up. Yeah, that's actually everything I could say.
Okay, that was good.
Thank you.
And I'm curious about this. I don't know if it relates to hypertension too. Maybe.
Yeah,
Could be a
sometimes.
cause?
Yeah, sometimes. As it is vascular, sometimes hypertension might like trigger this pain.
Okay. And for example, when we, in my career, when we make an put an anesthetic or something, we have to maybe try to be so careful with this nerve. And
Yeah.
for example, if it happens that we cause presbytia there, it will have some treatment for this kind of thing. Do you know about that?
I'm not sure, but I think that what is most dangerous when you put an anesthesia is that you touch the nerve. And when you touch the nerve is when what's the word I'm looking about? It causes inflammation of the nerve, and so you have to treat the patient with corticoids because you have to cause that nerve start inflammation. So I think that would be something important to take care about.
Okay. For example, if I put this on the nerve, in that moment, we don't know, right? Because
Yeah.
the patient is with the anesthetic. And after that, how much time we will have to wait or know that we cause this damage?
I'm not sure. I would say like a couple of days. I mean, even hours. I'm not sure actually. I'll look about it.
Okay, that will be great. And do you think the patients may refer pain or something like that because of
Depending,
the
you know,
inflammation?
as you said, if they like, if you put anesthetics on the nerve, it might stop working. Let's say, it will cause maybe difficulty chewing, also sensibility diminished.
Yeah.
So maybe it would be like progressive, but I think maybe in a couple hours, I think so.
Okay, thank you, Jorge. That will be so
Thank
good
you.
to know. And let's talk about another topic, okay?
Sure.
Remember we were talking about fractures?
Yes.
I will put you in a situation. Imagine you have a female dancer patient, okay? She comes to your consultation and you have to explain to her the cause of her condition and how would be the management.
Okay. What happened to her actually? Did she fall or something? She's a dancer and
Yeah, she's a dancer, and you can imagine whatever you want. She get hit by a car, he fall down, I don't know.
okay.
But she has a fracture.
Okay. I would explain her that depending on the case, depending on the fracture, I would explain her that if she first of all, the clinic exploration is a must. I would say that I would ask her if there's pain, how long ago it happened, because we have something that is called in Spanish as well, actually in English, I would say that it's post-traumatic stress, and it releases the pain for around 3 hours. So in those 3 hours, she might not feel pain because due to this post-traumatic stress. But on exploration, I would look about a movement of the bone. I would explain her to, in this case, if she needs surgery. First, I would ask for X-rays to see if she needs surgery or she just need like resting. And I would explain that she would have to stop dancing, of course, if it's an important fracture. Anyways, she would have to stop dancing due to she would have to rest, and that the treatment is going to take a few, in the case of the fracture, maybe a few weeks, maybe a few months. And I would tell her that she should have take care. I don't know what else. I think depends a lot on the fracture, on the case, in a specific case.
Yes, about that. What kind of fracture would be the most common one in these cases?
Well, maybe if she fell, I don't know, it could be depending on age. Maybe a displaced fracture. I don't know, could be. Or an impact fracture. So the bone is still completely set, it's not displaced. So maybe that would be those would be the most common cases, I would say.
Okay. And what would be the treatment in both cases?
In case of displaced fracture, I would say that surgery is a must, with all the devices, all the instruments on the OR. The surgeons might take care of it. And in the case of in an impact fracture, I would say I forgot how to say it. Yeso is I'm not sure.
Plaster cast.
Plaster cast. Thank you so much. Yeah, plaster cast would be the treatment in that case if the fracture is still okay. I mean,
Okay. Okay, Jorge, that was so good. Thank you so much for your time. I will send to you my questionnaire.
okay.
I hope you can see it.
Oh,
There
yeah.
you go. Perfect. And while you do it, I will take a picture, okay?
Okay.
Well, you have a good level of English
Thank
and
you so much.
also a good level of vocabulary.
Thank you.
So this class, it will help you to make better and fluently, but you have a good level. So
Thank you so
that's
much.
so good.
Yeah, I think
And
these classes are helping me a lot to practice my English, you know, because
yeah.
as I don't practice English at home, I mean, you know, it's
Mhm.
not like I can speak fluently sometimes, but I'm feeling okay. Thank you.
Yeah, but you have a good level and you make yourself understand. You have a lot of technical words in English. That's good. That's a good
Thank
level.
you so
I
much.
mean, you are one of the most I don't know how to say. I don't want to diminish the other ones.
Thank
But
you.
you
No,
are
I
in a good
understand
level.
you.
Okay.
Yeah, it's just that I had the opportunity to live in the US and I did a rotation. Yeah, I did a rotation and
Okay. That helps you a lot.
yeah, so that helped me a lot. At the beginning it's really hard, but then yeah, like it's just to feel comfortable with yourself and you speak fluently.
Yes, that's right. And more likely a native people from there, right?
Yeah, exactly. It's
So
totally different.
yeah. So thank you so much, Jorge, and see you
Thank
on
you.
Monday.
Okay,
Okay?
great.
At
Thank
8.
you. Have a
Take
great
care.
weekend.
You too. Bye-bye. Hi, Mateo. Good morning.
Morning. Sure,
Can
how are you?
I'm pretty fine. Thank you. And thank you for coming so early. Can you put on your camera, please?
Okay. Wait, please.
Yes, of course.
I just wake up, so
Okay, no
I'm a
worries.
mess.
No worries. While you are taking this time, I will ask you to make a list of causes of anemia.
A list of causes of anemia. Iron deficiency, or how? I mentioned to you.
Yes, please.
Okay. Iron deficiency, mutations that affect the hemoglobin structure. Lack of some nutrients like thiamine or folate. Bit of vitamin. Another cause, some infections, chronic infections. Hemolysis, autoimmune diseases, adverse reactions to some medications, hypovolemic anemia, like bleedings, bleedings.
Okay, you mentioned
That's pretty
one
much.
before that. Before the hypovolemic, you mentioned another one. Which one was it?
The first causes,
the-
adverse reactions.
Yeah, I think it was because of pharmacs or drugs. You
Yeah,
said.
yeah.
Which kind of drugs will cause this condition? Remember?
Mm, some antibiotics, like chloramphenicol.
If you don't remember right now, okay. If you don't remember it, no worries.
No, it's
I'm
good.
just asking you to. Okay, perfect.
Okay, it's good.
Well,
Chloramphenicol. Yeah, I can remember any other causes of anemia. I think there might be one or two more. I don't know.
Okay, go ahead.
But I can remember.
Okay, no worries. Can you pick a disease or condition, anyone you want, and describe the signs and symptoms? And if you want, you can give the treatment for this.
Okay. Okay, I'm gonna go with cholecystitis. Okay, so it's a disease caused by that is gallbladder inflammation. It can be caused by infections, or more commonly by formation of stones in the gallbladder. These stones can be generated by increase of cholesterol containing bile and decrease on bile salts in the overall composition of bile. It commonly presents as pain in the upper right quadrant of the abdomen. Most commonly after meals, the pain is commonly triggered after meals, after fatty meals, and sometimes it can cause fever, abdominal pain, and when we have the suspect of this disease, we have to make some maneuvers on the right upper quadrant, below the infracostal border. We have to make a Murphy maneuver that consists in pressing the inferior border of the inferior costal border, and in the mid-clavicular line. And if the patient experiences pain, it may be a positive maneuver. So it's more more possible to the patient to have this disease, and we have to how's this word? Derive it to
If you don't remember,
ecology.
you can describe. Okay.
Okay. So we can derive it to call. What is this? Ultrasound. So to ultrasound diagnosis. So the technician can, or the radiologist, whoever is in charge of, can watch and describe what's inside the gallbladder. And commonly we can see the stones generated in the gallbladder, and with that conclusion, we have to decide if it's a chirurgical treatment or a conservative one. If it's a chirurgical treatment, then you have to schedule the patient to OR and operation. You have to, cholecystomize the patient, and pretty much it. That is treatment for the patient.
Okay, Mateo, that was good. Thank you. You have a lot of vocabulary. You make yourself understand, and that's so good. Have a good level too. That's so good. And remember that we were talking about fractures, right?
Yeah.
The last class. So I will put you in a situation where you have a patient, a young female dancer patient, okay? She has a fracture. You can imagine, I don't know, if he was hit by a car or he fall down, maybe when she was dancing, I don't know. But how would you explain to her the cause of her condition and what it would be the management?
Okay. So if she's a dancer, she's most probably have a base of the 5th metatarsian fracture. So I would claim that her occupation or her hobby, I don't know, puts a lot of stress under the base of the 5th metatarsian, and this can be this is super common among dancers. So she had to rest my until this pathology resolves, until this resolves, and she might have to go under physical therapy, and may have to reschedule. She may have to
return to the patient.
Yeah, return to dancing stuff, but less frequently. That's the word. Less frequently, or less time during each session. So she don't put a lot of stress under that structure in her foot or feet. Yeah.
Okay. And what is the most common fracture in these cases?
Most common fracture in tensors.
Yes. Yeah, I mean, the displaced one or the committed, I don't know.
I think it will be a stress fracture, right? But I'm not really sure. I think
Mhm.
it might be the commuted one.
Okay, while you're explaining to me, please, can you fill my questionnaire?
Okay, that's I did it.
Thank you. Thank you. Okay, in a case that you have a displaced one, what would be the treatment?
The treatment.
Yeah.
In that, in the location that is that the accident was, I think the treatment would be I don't know. It depends if you're an expert or not. If you know how to reduce a fracture or not, you know.
Okay.
And it depends of the grade of the fracture, because if it's a displaced and you don't know how to reduce the fracture, you
Mhm.
may immobilize that part, trying to not the trying to trying to not make the patient move that limb or whatever is fractured. But if you're an expert, you may try to reduce the fracture or get it to the OR and reduce it surgically. That was me the most appropriate treatment, I think.
Okay, Mateo, thank you so much. That was so good. Remember, we have one more class to replace since we don't have the first one practical class, right? Maybe I will ask you next week if you have time on the next weekend, or if you can't do it, we can make it after a theoretical class, okay? We will figure it out. But that's all. Thank you so much and see you on Monday, okay?
Thank you, teacher. See you Monday.
Thank you. Take care.
Have a good day.
Bye. You too.
You
Bye
too.
bye.
Bye.
Teacher, good morning. Sorry, I'm a little bit late.
Hi, Vale. Good morning. Can you put on your camera, please?
I can't, teacher. I told you last class that I'm trying to fix my camera on the laptop, but that I need to change all the screen.
Okay, no worries. But try to make it, okay?
I tell my brother if he can buy like a little camera, so it will work not only for these classes, also it will work. but I will try to have the camera for the next week. Please, please, please.
Of course, no worries. Okay,
Thank
Vale, thank you so much to have the time to be here this morning, okay? And remember, we have one more class left to replace since we don't have the first practical class, okay?
Yes.
And next week, I will ask you actually if you have time to make it next weekend again, if you have time, of course, or maybe after our theoretical classes, okay?
Okay, but I think for the next weekend it's okay, or after classes, I don't have problem, sincerely. For me, it's okay. Whenever you
Okay.
have, okay.
Okay, thank you so much. And now we can start then. Can you make a list of causes of anemia?
Anemia. Well, when you okay, the extraction of red cells, when you have like a less number of red cells, and it was 3 causes. I don't remember the last one.
No worries. In your experience and what you have learned, you know so many cases, not only the causes, sorry, not only the ones that I mentioned it last class. So try to remember what would be the causes for anemia in general and try to make a list for me.
Okay, maybe when you lost a lot of blood, also
Okay.
when in your diet you don't like consume a lot of vitamin, or I don't know how to say iron, if I'm not wrong.
Iron,
Yeah,
and you can say vitamins, okay?
vitamins. When you don't consume a lot of vitamins or iron, also, I'm not exactly the cause, but when a person has like in their hands like a yellow color, and the person has a lot of
Pallor?
the color of the hands.
Okay. I don't know exactly the name of this sign, but I will write it down here.
Not
On
ictericia, I don't know the name in English. Like when you are yellow, it's
down dance is ictericia, or you can say it, but pallor is palidez, pallor. And I write it down on the chat site.
on that. Yeah. Okay, it could be pallor. Thank you.
Okay.
I will write here, so don't
Yes.
forget pallor. Yeah, it could be pallor, and the person has a lot of the person wants to sleep all the time, so it's like a signal of that person can have
asthenia or
yes.
tiredness.
Yep.
Okay.
Later, when it has a genetic thing, like a plastic anemia, or a sickness that is more complex, you can say. And I think those are the causes.
Okay. Those the most frequent causes, right?
Yeah. Also, maybe that has a lot of, because it's like a big topic, you can say, but I
Yes.
think they're the most common that you can see.
Okay, the most common ones. Perfect. Vale, I want you to choose another illness, and maybe you can describe the signs and symptoms. And of course, if you want, you can describe the treatment for this condition.
Uh,
Pick any kind of illness you want.
I think one thing that it's really, really common is, but I don't know how to say, vesicula. I will search.
Bladder gut, cholecystitis.
Yeah, cholecystitis.
Okay, try to explain it in English. Don't make the translation. It will take you more time and it will be harder for you.
Okay.
Try to, even though if you know if you don't know the word, you can describe it and you can ask me. If I can answer you, it will be great. If we don't know, we will find it out, but try to make it fluently, okay?
Okay. Gallbladder.
Okay.
Thank you. Thank you. Well, gallbladder, it could be like the symptoms, maybe stomach pain or pain in the right
Stomach ache. Stomach ache.
Yeah.
Mhm.
Ache. Right. Stomach ache, also pain in the right upside of your abdomen. Then you can have fever, nauseous. Also, you can vomit. And when you vomit, you can vomit like the aliments that you consume, or also, I don't know how to say, bilis. I'm not the yellow thing that helps to destroy the food in your intestine.
Okay.
But when you vomit like bilis, like a yellow thing, like a egg sometimes.
Okay, let's find it out. I don't remember, but okay, continue. Well, I'm looking for.
Okay, so until you tell me the name, I will say bilis.
Okay.
You vomit the bilis, more bilis than aliment or another thing. Also, the pain in your stomach, the stomach ache, or the pain in your abdomen is like it goes to the abdomen, to the back, abdomen to the back. Then you also can sweat. Like you don't have like a fever, but you also sweat. Yeah,
Maybe episodes of fever.
it depends, I know people that has episodes of fever, like fever 38. Then the others is like the temperature is high, but it not considered like fever.
Like febricula, what we call febricula.
It could be febricula.
Okay.
Or only
the correct name it's low-grade fever. Okay.
Low-grade fever.
Low-grade fever. Okay, continue.
Low-grade fever. Temperature.
Yes.
Okay. So I think that the most important things or the common things to think about cholecystitis.
Yeah, cholecystitis.
Cholecystitis is the pain in the abdomen that goes to the back, Another thing is like when the person has nauseous and they vomit about it has to vomit by bilis.
Okay. The correct word is bile for bilis. Okay, bile.
Yeah.
I write it down on the chat side or on the chat box.
I think if the person told you that it has that pain with that characteristics in vomit bile, you think about the illness.
The cholecystitis. Perfect. Vale, that was good. That was really good. Okay. And last but not least, remember that we were talking about fractures?
Yeah, fractures.
Okay. And imagine I don't know, what would be the treatment or displaced fracture?
I think you have to go to surgery and put and replace the bones to the place.
Okay.
And you can replace with screws or like osteosynthesis material.
Okay.
And with you put that and you close the skin and all the body caps, you can say. The person has to don't move like the part of the replace, and then with the time it can move like slowly.
Okay, can you use a plaster cast?
Yeah, if I don't remember. Yeah, also like you say, but it's a long name that I don't remember, like yeso.
Plaster casts.
I was not right if I remember the good thing. Yeah, you can.
Okay.
Exactly.
Okay. Vale, that was good. Sorry.
No, you go first.
Okay. Vale, thank you so much then. And we will see you on Monday, okay?
Okay, teacher. Thank you. Have a good weekend.
Take care. You too. Take care. Bye-bye. Hi, Claudia. Good afternoon. Good afternoon. Good morning. Can you listen to me? Hello?
Hi, teacher Michelle. Sorry.
Oh, hi. No worries. Good morning. And can you put on your camera, please?
Okay. Okay.
Thank you so much. Claudia, remember we have, first of all, thank you so much for having the time to stay here today. Okay, we have one more class left to replace, okay, since we don't have the first practical class, but we will figure it out if we will make it on next week or next weekend. I don't know, but I will ask you if you have time, okay?
Okay.
Okay, perfect.
I think I don't know which is the third class that I dismissed. I saw the classes of the parts of the body, I think. And I think that's what class 1. In the half of the class 2, but the class 3 was on the last Monday. I don't have the link.
Okay, I will send it to you. No worries. and you will have time to watch it, and then we will make a schedule with you, okay?
Okay.
And well, first of all, I will ask you to make me a list of causes of anemia
Of
in
causes.
general.
Okay. High blood loss. Pernicious anemia. Different kinds of cancer, maybe, like medullaroplastia, I think. I think that are the most common causes of anemia. Teacher.
Okay, deficiency of iron.
Deficiencies of iron, yes, sir.
Okay, that's the most common one, right? Okay,
Yeah.
I want you to pick up any illness you want. Oh, continue.
No, I think that the deficiency of iron is the most common cause Bolivia.
Yes,
for the parasites,
especially
yeah.
here.
Exactly.
Yeah. I don't know. I want you to choose any kind of illness you want and describe the signs and symptoms and the treatment. Okay?
And the treatment. Well, I don't know, COVID-19, for example. It's okay.
Okay, given the signs and symptoms and the treatment. That's good.
Okay. The signs of COVID-19, it depends of the variant. But for example, with the most common variant that it's where the pandemic began, it was fatigue, weakness, cough, fever. I think it's in the not severe form, I think, in the most simple form. And you can treat it that form just with drugs with for the flu. I don't know how to say antigrippales.
Yes, but you're described so well. Antigrippal.
Antigrippal, okay. And medicine for the cough. That's all. For the moderate weight of the disease, you also have the loss of the smell, I think, and the, I don't know how to say dysgeusia in
the taste.
English.
Dysgeusia. We'll find out.
Yeah.
I don't remember.
You lost the taste and the smells.
Dysgeusia.
Dysgeusia. Okay.
That's the pronunciation. I will write it down here on the chat side. Okay.
Yeah. And you have a low level of blood saturation, but in a worried percentage, I think. For example, it was normal 88 or 89 or 87%. So the treatment for that kind of COVID, just it was also the drugs for the cough, antigrippals, and also the resting of the patient, and so many fluids. And for the severe form of the disease, you have pneumonia and respiratory distress. So in the respiratory distress, you have blood saturation under 90, under 80%. So here in La Paz, also you have cough, more fever, headaches, and some symptoms of the respiratory distress. It was the respiratory frequency, it was higher also. And you can see a little of cyanosis, I think, in some patients in the worst form of the disease. And the treatment for that form of the disease, it was antibiotics, but strongest antibiotics that you have to infuse for the vein, and antigripals, it doesn't work here. Steroids also works at the first 7 days. I think we have some drugs, experimental drugs, like antivirals, like molnupiravir, for example. And I think that's one, the unique one that was proved, and it has the check to treat the disease here in Bolivia. And also it's very important that the patient will be in the prono position. It's the mouth, no, I don't know how to explain, but the prone position.
Okay, we will have a class in next week, I think, where we will explain these positions.
Being prone, okay.
Yeah.
Prone positions, I think. And in that severe form, the last alternative is the mechanical ventilation, and that the patients that has that severe respiratory distress, it depends of that, you have to manage the ventilatory machines with high levels of oxygen, for example. It depends of the gasometry. You can module and try to avoid respiratory acidosis. That is the common pattern on these patients, and also the hyperthermia that they will have. I think
okay,
the 3 levels of COVID.
Okay, that was pretty complete and well described. That was so good. You have a lot of vocabulary. Of course, we don't know sometimes everything, and we can figure it out and find it out looking for these words. But I think with the classes, you will get better with this. But you're good. You make yourself understand, and that's pretty much so good. Well, okay.
Okay, thank you.
But we have to practice the pronunciation. For that, I will look for a podcast. I don't know if you have Spotify.
Yeah, I have.
Okay, that will help us a lot. And but you're so good. Okay, I will send to you my questionnaire now, but we will still speak in just to make it fast. Okay, and I will ask you to, well, I will put you in a situation where you have a patient, a female young dancer patient that suffers a fracture. You can imagine how was the fracture and everything. And what I want is that you can explain to this patient what is her condition and what is the management of this. Okay, go ahead.
And where is in the foot is the fracture, I think? Or
wherever you want. You can imagine the case and tell me what is the position of you as a doctor. with your patient.
Okay. We receive a female patient that has an automobile accident, maybe. So she has the most probably a fracture of the thigh bone. We can see that for she's with a lot of pain. She obviously has an increasing of the volume of the thigh, and she can move the whole right leg. So we made an X-ray, and we can see the thigh bone fracture. It was, I think, comminuted, and it's very dangerous case with a lot of blood loss at the moment. So the treatment is to stabilize and reduce the fracture the most early fast possible. So we need to use a pin to reduce the fracture, and that's the only way for the surgery. And after that, she needs rehabilitation, I think, for 3 or 5 months after, and a lot of I don't know how to say it, to lay down, I don't know, to reposo.
To have a rest, or to take rest.
To take rest for maybe 3 months.
Okay. Okay, that was very complete, Claudia, and it was so good. Thank you so much for your time, and see you on Monday, okay?
Okay, thank you, Teacher Michelle.
Thank you, take care. Have a good weekend. Bye-bye.
Bye-bye.
Hi, Melanie, good morning.
Hi, Miss, good morning.
I don't know if you can put on your camera, please.
Oh, I know in my phone. I don't know if my...
Oh, okay.
Yes.
Okay, no worries. For the next time, okay?
Yes, it's a promise.
Perfect. First of all, thank you so much for coming today to this class in this morning. I know it's time to rest, but thank you so much for that. And remember that we have one more class left to replace, since we don't have the first one practical class. And we will figure it out when we will go, and we will make it, okay?
Okay, Miss.
Perfect. I will ask you, please, to make a list of causes of anemia in general. Make a list.
You mean the symptom of anemia?
Yeah, the causes. What cause anemia? Okay, you can make a list. I know there's a lot of types of anemia, and they have a lot of causes, but you can. I just want to have the causes. Okay.
Okay, yes, understand. For example, we have, the causes, for example, if the people maybe it's a problem of the body, or maybe it's the with the type of the alimentation in the early, no? For example, we have the possible cause of anemia, maybe can be the vitamin B2 the deficiency, or the
deficiency of B12 vitamin.
B12, yes. certain medication include cause anemia, the destruction of the red blood cells earlier than normal, no? Which can be because by problems with the, for example, the immune system. Other causes can be the folate deficiency in the body, or maybe the lack of iron, because it's other cause of anemia.
Perfect, Melanie. Thank you. What is the cause of, you mentioned that one of the causes is a medication. What kind of medication cause anemia?
For example, I think that it's the medication that can use like antibiotics. For example, the cephalosporins. I don't know if that is
Okay,
the
that's
answer.
good.
Mhm.
Oh,
Or the most common that we use, the AINE, the and Ines. I don't
yeah,
know how
Ines.
you can say in the English.
Yes, no, that's it's the same, Ines.
Okay. Um, Other medication can be um, for example, that we can use in the urinary infection like nitrofurantoin.
Mhm.
Uh,
Nitrofurantoin, that's the one
mhm,
that cause, wow, I didn't know that. Okay.
mhm. Or other, I think that include the type of or kind of penicillins too.
Okay, thank you, Melanie. Well, I want you to pick one disease or one condition and describe the signs and symptoms of this condition. Also, you can give me the treatment.
Of any disease?
Anyone you want. Yeah.
Oh, okay. For example, we have the, I don't know, the most common or maybe the disease that is usually in the people, for example, a disease of the stomach. Uh, I think that I can use, well, no, I can explain about the gastritis. I don't know if the pronunciation is similar or
Gastritis.
mm,
Gastritis.
gastritis. Yeah, that is a group of the disease. The most important it's characterized by the inflammation of the lining of the stomach, and it can be caused by a lot of things, like maybe include the stress, uh, caused by infections. The most popular is about the Helicobacter pylori, and be caused by injuries, frequency, the use of pain uh, relievers called the NSAIDs, or maybe the type of the diet. If the patient drink a lot of alcohol or maybe spice food, and and in this disease, for example, the patient usually say that they feel uh, stomach pain, they have maybe nausea or indigestion, and the most popular symptom in that is the uh, burning they feel the burning in the stomach, uh, in when they have maybe hungry or when they are stressed. In
Okay.
these cases, in the gastria, the patient, it's important to have a, a health diet. They have to eat in regular times, in their times. It's recommended that they have their breaks and dinners in the same hours every day. Have a rhythm in their diet. The the diagnosis is more exactly with a no how do you say in English? Endoscopy in
Endoscopy.
endoscopy. Yeah, this is the standard goal with the diagnosis of bacteria. We can recommend in the patient to depend of the level of this anti-acid, or if we found in the patient the Helicobacter pylori, we have to recommend antibiotics for that. And well, I think that is the resume of this.
Okay, that was very complete actually. Just one thing, antibiotics. Okay.
Antibiotics.
Yeah, is the correct pronunciation. And as I told you, well, gave me a good description of those diseases or conditions. You have a lot of vocabulary, I can say. Of course, we can improve, and we will make it in these classes, okay? But please try to practice a little bit of your pronunciation. Of course, we will improve with these classes too. But I think I can give you some. I don't know if you have Spotify.
If we have what? Sorry, I
Yes,
can.
Spotify, where you can listen music. It's an app.
Oh,
Yes.
to be honest, I don't have a Spotify, but I usually listen music in my phone or maybe in YouTube. It's more
Okay. Okay. I was asking you this because I think I can have a podcast that can be so useful for you to practice your English, but we can find YouTube too. So I will look for this and I will give you the link, okay?
Okay, miss. Yes, thank you so much.
Okay. And now I will send you my questionnaire. While you will fill it, we will still talking about another topic. We have talked about fractures, right? Last class. So I will put you in a situation. Thank you so much. Imagine you have a patient, a young female dancer, okay, that comes to your consultation with a fracture, okay? How would you explain to her and the cause of her condition and what it would be the management?
Okay, so I have a patient with a fracture and I have to explain the situation, the disease, and the treatment. Okay.
Yes.
What kind or what time of fracture I can choose?
It's up to you. It's up to you.
Okay. Okay. Vale. Well, hi, I'm the Dr. Melanie, and I will tell you about the fracture. Well, we need to have a X-ray to see better what kind of fracture you have. In this X-ray, we can see that we have I don't know, comminuted fracture, comminuted fracture, and for
comminuted fracture.
Comminuted fracture, and for this kind of disease, we have to need uh, don't move. We have uh, to use a cast, and we have to go with the surgical room, because we have to put the screws, and that the recuperation have maybe some weeks, but it's treatable. And well, that's the I don't know how much to say.
That's one thing. It's the recover. Okay.
Oh,
Talking about recuperación.
okay. When the treatment of this condition can involve when the reason is put the bone in the correct place. We don't have to move it. We have to use scats or a splint, ferrula splint, and sometimes in this case we have to do a little surgery to put screws of metal, and to stay the bone in the correct place and in the correct forms too. We have to recommend with this the the physiotherapy to restore the strong and the muscular function, and we have to do after that exercise. No, with for example, the fracture is in the arm, we have to do exercise with the arm, with the hand, and that take um, months to recuperate, but it's other if this recuperation is frequency, and we are strike with this exercise, we can recuperate in less time, no?
Okay, that was good. Thank you so much, Melanie. And we will see you on Monday, okay?
Okay, Miss, thank you so much. Thanks for your
Thank
time.
you. Take
Have a
care
good
and
day.
have a good weekend.
Thank
Bye-bye.
you, Miss.
Hi.
Hi, Carla. Good morning.
Good morning. How are you?
I'm very fine. Thank you. First of all, thank you so much for coming this morning and have the time to take this class, okay?
problem.
Second, remember we have one more left class to replace since we don't have the first class, the first practical class. So we will make it, I think, next week, but I will find out if you have time, maybe after a theoretical class, or if you have time on weekend, we will figure it out, okay?
Okay. It's okay.
Okay, let's start it then. Can you make a list of causes of anemia in general?
Let me see my note.
Yes.
In Ecuador, it's 9 a.m. and yesterday I went out with friends, so kind of tired.
I'm so sorry.
But I don't drink. So I was just talking and no, I feel tired.
Oh, okay. It will take us just 15 minutes.
Okay, causes of anemia, it could be a bad nutrition, a bad alimentation. I don't know how to say that, this abnormal absorption of acid of folic, I don't know
Folic
how to say.
acid, folic acid. Yeah.
Or vitamin B12. Maybe in some people like vegans and vegetarians, they don't have the enough amount of vitamin B12, so they can develop an anemia. Other causes, bleeding, and this bleeding could be acute or chronic. And let me check. Alcoholism could develop anemia. Cirrhosis.
Yes, let me check the pronunciation, just that, but go ahead.
Cirrhosis. Let me think about. Yeah, I think those are the main, and some I don't know how to say hereditario.
Hereditary
Causes like thalassemia, and I forgot this name that occurs more in Black people. Drepanocytosis. I think it's the same word.
Okay, for the pronunciation, cirrhosis.
Cirrhosis. Okay.
And I will write it on the chat side, the correctly spelled, so you can write down if you want.
Sí.
Okay, perfect. If you want to add something else, it would be so good. And
I think those are the main causes of anemia.
Okay. And I will ask you to choose any kind of disease or illness you want. Describe the signs and symptoms and the treatment, please.
And the treatment. I think this stomachache or gastroenteritis está bien. It's okay. Gastroenteritis. Joint.
Gastroenteritis.
Gastroenteritis. I think it's one of the most common causes of consulting a doctor. So I think the causes, it could be a bad alimentation, parasitosis, some spoiled food, that you could eat. Those are the main. And then the sides are stomachache, nausea, vomiting, diarrhea, maybe fever in some cases, and I don't know how to say this. When you have malestar general, I don't know how to say that.
As asthenia.
Asthenia, okay. And
Fatigue,
those are the signs.
or tiredness. Then what else? Okay, we can find
or
out more.
General, or about
Yeah.
general condition. I don't know.
Yeah, that's a good description.
Yes, and the treatment, it could be the first, determine the cause. Second, hydratation. It's a really important step. Maybe find out if the person could tolerate the oral hydratation, and if it's not, you could have another way, like parenteral ways, and you could give a medication for the symptoms like vomiting, like stomachache, and diarrhea. But if in 3 days you could see, or if you can do any laboratory analysis, you could maybe start antibiotics and probiotics. It could be a good option after the acute illness. And then I think that the person could start with light food, and during the days before, they could have a normal life.
Okay, so you can give your patient rehydration salts or just serum?
No, I think both. It depends the cause. It depends the hydratation grade, and it depends too to the tolerate of the patient. So if the patient does not tolerate just how do you say suero?
Serum.
Serum. If the patient don't tolerate serum, you have to take another way. But if the patient tolerated, you could have this serum like for 12 hours, and after that you could increase some another liquids and then solids.
Okay, perfect.
The important thing is that you don't stop the feeding or the alimentation for a long period, because the bowel could have some alterations in the, I don't know how to say, mucosa, in the bowel mucosa,
mucous membranes.
Mucous membranes.
Okay.
They could die.
Wow. Yes, it's the most absorbing place,
Yeah.
right? The mucus
Yeah.
membrane.
And if you have no food for a long time, these little, I don't know how to say this, vellosidades, these little, I don't know, they die. So you will have problems with the absorption of nutrients and water, including medicine. So the important thing is recognize the causes and try to start a normal alimentation as you can.
Okay. Stomach villus, or in case you were talking about intestine, is the same, but villus. I write it down on the
Villus.
chat.
Bowel, yeah, stomach villus
Okay.
or bowel villus.
Let me check this.
This is important
Yeah.
because that's the cause. Because that's the cause that some people told us I have diarrhea for 2 weeks. Yeah, because these bills are not absorbing anything.
Wow. And that's a dangerous thing, right? To have diarrhea for 2 weeks.
Yeah,
Yeah, the hydration, yeah, so many things.
the nutrition, it's important.
Yeah. How many days we can stay without having something to eat?
Food.
Yeah.
I think no more than 3 days, because you have to think about you don't have the nutrition, you don't have the glucose you need.
Mhm.
So it's important. It's important to re-establish, re, re, reestablecer,
Reestablish. Yeah, that's good.
reestablish
Reestablish.
a normal alimentation.
Okay,
Yeah.
that's good. Thank you, Carla. I will send to you my questionnaire now. And while you answer this, I will ask you to, well, I will put you in a situation, okay, where you will have a patient, a female young dancer patient that suffers a fracture. You can imagine where, when, how. And what I want is that you can explain to your patient what is happening to her, or what is her condition, and how would be the management.
Well, the first thing I told the patient is to try to stay calm. I think I know that it's a painful condition, but calm is necessary. Then I have to examine all the patient to know where is this fracture. Fracture is okay? Yeah, this fracture, and then try to know what about the fracture is. Immobilization is the first step. Let me check. Same clase. Bye. No. Bye. I forgot what I was saying. Immobilization. Immobilization is the first step after you could send this patient to another to a hospital or yeah, a hospital. You may need analgésicos.
Analgesic. Yeah, analgesics. I forgot too.
Analgesic or medicine for the pain and X-ray. It's very necessary.
Painkillers.
Painkillers.
Yeah.
Thank you. Me falta vocabulario, a ver si me trabo.
No,
Painkillers.
you're so good. Of course, we want we have a lot of vocabulary more to learn about, but you have a good level, so don't feel bad about you not remembering. It happens all the time. I'm giving the classes every single week, and I still forgot some definitions, so it's so
Yeah.
common. Okay, but with practice, I think it will improve, so no worries.
That I think it's the first steps you have to take, and then well, I think I am a family doctor, so I only can immobilize a patient, but then you need an orthopedist to evaluate the patient, the fracture, and the procedure, because this could be just clinical or maybe a surgical procedure. I think that's all.
Okay, that's so good. Just one thing. And mobilize is the correct word. Okay.
What I did.
And mobilize is the correct word. Yes.
And mobilize.
Okay.
I'm gonna study this day.
Okay. Have a rest. Okay. Thank you so
Thank
much
you.
for coming, Carla, and see you on
So,
Monday.
Monday. Okay,
Yeah.
thank you.
Take
Have
care.
a good day.
Bye-bye. You too.
Ciao.
Jocelyn, good morning.
Good morning, teacher.
Can you put on your camera, please?
Okay, teacher.
Thank you. Okay. How are you?
I am great, teacher.
Perfect. Thank you so much for coming this morning. Okay, I know you want to rest this day, but you have the time to come to this class, and that's why I'm so grateful. We have one more class to replace, okay, since we didn't have the first practical class, but we will replace it next week. Okay.
Okay, teacher.
Okay. And now I want you please to make a list of causes of anemia. I know there are a lot of types of anemia, but I just want you to give me the causes of anemia in general. Do you understand?
Yes, teacher. ¿Cuántos tipos de anemia tenemos? ¿No?
No. We have a lot of types of anemia, but I just want you to give me a list of causas de anemia. Quiero que me hagas una lista de las causas de la anemia en general. No importa cualquiera que sea, pero tú me das las causas de la anemia en general. ¿Qué le quieres?
Sería
En
hemorragia.
inglés.
Ah, ya.
Hemorrhage.
Hemorrhage.
Okay.
Sería iron
Deficiency.
Sí, deficiency. Anemia. Anemia. Anemia hemolytic.
Hemolytic anemia.
Anemia. No, hemolytic anemia.
Yes.
Hemolytic anemia. Megaloblastic anemia.
Yes.
¿Cómo se dice, teacher? Normocítica.
Neumocítica.
Normocítica.
Normocytic anemia.
Normocytic.
But you're making a list of kinds of anemia. What I want is that you can give me the causes of anemia. You said hemorrhage, deficit or deficiency of iron, maybe, I don't know, deficit of vitamins, and all those causes. I know you can. I know you can. So go ahead.
Perdón, teacher, no se entrecortó.
I know you can. So go ahead.
Eh,
¿Qué otras causas para la anemia hay?
ya.
If,
Mm,
if you don't remember right now, we can change another topic. Maybe you can choose one condition or illness, any one you want, okay, anything you want, and give me the signs, symptoms, and treatment of this condition. Pick up one.
yeah. Okay. The symptoms.
What condition are you describing?
Yeah.
I don't know. If you want diabetes, hypertension, gastritis, I don't know. Any disease you want. Pick up one and then make a description, the signs of symptoms and treatment. Do you understand?
Could be the pneumonia, teacher.
It could be pneumonia.
Pneumonia. Fever. Fever. Después cough.
Okay.
Cough. Loss of appetite.
Appetite.
¿Cómo es, teacher?
Appetite.
Appetite. Swelling.
Swelling.
Swelling. ¿Cómo se
Swelling.
dice? Swelling.
What are you referring to?
Sudoración.
Okay, sweating.
Sweating. Sweating. Okay. Fast breathing. Fast breathing.
Okay.
Fast heart rate.
Okay.
Sería sharp chest pain.
Okay.
Ya. Dehydration, deshidratación, ¿cómo se dice, teacher?
Dehydration.
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 Repeat one more time. Dehydration.
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 Hydration. Remember, it ends with an N. Okay, go ahead.
Sería malaise.
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 What would it be the treatment for this?
La descripción de malestar, teacher.
No, the treatment. El tratamiento. What would it be the treatment?
Ya. sería cepriaxone.
Okay. What else?
Levofloxacin.
Okay, the patient must have to rest or use some I don't know. He wants to use some tool to breathe better.
¿Cómo, teacher? Perdón.
Te pregunto si el paciente necesita algo más que medicamentos. ¿Necesita algo para respirar?
Sí.
¿Que le ayude?
Oxígeno, ¿cómo se llama?
Oxygen. Oxygen.
También, también se le podría dar esos aerosoles. ¿Cómo se dice aerosol?
But the name is not aerosol. It's I know what you're referring to, but I don't remember the word either. Okay.
Nebulizaciones también.
Yes, nebulizations. Or yeah, that's the word. Okay. Okay, my friend, Jocelyn. Jocelyn, poquito a poco estamos mejorando, ¿verdad? Creo que entendemos un poquito más porque ahora ya hay mejor señal también, ¿no? La anterior vez estaba entrecortado y seguramente no podías entender casi nada de lo que te estaba diciendo. De todas formas, necesitamos practicar más. Vas a ver los videitos, no te olvides, entrar, revisar de nuevo la clase. Después de eso ya vas a estar más fresquita. Practica la pronunciación, volvé a escuchar, eso te va a ayudar un montón. Repetí después de todo y va a ser constante, hasta tú te vas a acordar, tu memoria va a mejorar. ¿Ya? Por favor, llena mi cuestionario. Voy a sacar una fotito aquí. Y listo. Okay, thank you so much, Jocelyn. Te das cuenta que el tiempo pasa súper rápido, ¿no ves?
Sí. Yo quería consultarte.
Claro.
¿Cuál es la diferencia entre paint y hurts?
Hurts. Pain.
Ajá.
Pain y hurt. ¿Ok? Por ejemplo, ambos son sinónimos de dolor. No hay una diferencia exacta o específica como traducción en sí. Ambos significan dolor, pero hay usos específicos cuando hablas de, digamos, por ejemplo, incluso en el dolor de estómago. Tú dices stomach ache, ¿verdad? Ache es también sinónimo de dolor. Stomach ache, backache, dolor de espalda, headache, dolor de cabeza. Cuando hablas de, por ejemplo, me duelen los pies, my feet hurt, ¿entiendes? Mis pies me duelen. O si quieres decir con pain, puedes decir, I have a pain on my foot. Tengo dolor en mi pie. Entonces, hay diferentes formas de utilizarlo, ¿ya? Lo único que no te tienes que confundir, ¿no? Con la pronunciación. Es heart. A ratos uno se confunde con lo del corazón. Corazón. Heart. ¿No? Heart es corazón. Heart es dolor. Entonces, ¿te das cuenta de esa pequeña diferencia? Uno es como uno es con A y el otro es con AE. Ajá. Entonces, El corazón, ¿cómo dices me duele el corazón? My heart hurts,
My heart.
¿no?
Ajá.
Entonces así. Ahora, si quieres con pain. I have a pain on my heart or on my chest. Tengo un dolor en mi corazón o en mi pecho. ¿Ya? Entonces son sinónimos, pero sí la pronunciación es bien importante porque si tú pronuncias dolor como corazón, ya cambia, ¿no? La historia.
Mm.
Entonces es así.
Ah, ya.
La pronunciación, eso tienes que enfocarte, pronunciar bien, tratar de mejorar un poquito más la capacidad de hablar. Una vez que mejoras tu pronunciación, ya conoces un poquito más de palabras, tu oído vas a ir educando, porque el oído también es importante. Si no comprendes lo que te estoy diciendo, ¿cómo vas a poder responder, verdad? Entonces, todo viene en uno, es un conglomerado. No puedes, digamos, por separado querer practicar unas cosas, o todo te va a ayudar para lo mismo. Es una conjunción, ¿ya? Entonces, practica, ve los videitos y vas a ir mejorando. Nos vemos el día lunes. ¿Te parece?
Está bien, teacher. Gracias. Hasta luego.
Muy bien. Thank you. Bye bye.
Bye bye.